Well, hello there. I'd like to talk about medical treatment in the Philippines. Now, um, the medical treatment in the Philippines is pretty much just about the same thing as Western countries, but it's a little bit different, and I'll explain. Last summer, I had a motorcycle mishap on some gravel in Bohol, and I had some few cuts on my legs, and for some reason my right leg swelled up a little bit, and so I went to the regional provincial hospital over there. And so I went over there and I went to the outpatient clinic, and they said, I said I wanted to see a doctor, and there was a guy there. I think he was a registered nurse, and he was kind of like the go-to guy, managing, the people that wanted to see the doctor. So he told me, yeah, you can see the doctor, but it's 150 pesos. And so I said, okay, 150 pesos. So I was going to take out 150 pesos and pay him. And he said, no, what you need to do is you need to go to the business office and pay them. And then after you pay them, then bring the receipt back. And then I'd wait and see the doctor. And I said, okay. So I said, where's the business office? He told me where it was, the next building down. And so I went to the business office, paid 150 pesos. They gave me a receipt, and I brought it back. And he took my blood pressure and weighed me and told me to sit in the waiting area. And eventually, I don't know, I guess within 10 or 15 minutes or so, maybe a little bit longer, then I saw the doctor. The doctor wrote some orders, and one of the orders was a tetanus shot. So I asked this guy, I said, well, where do I get this? And he said, well, you have to go to the pharmacy. So I went to the hospital pharmacy, and I said, I need the tetanus shot and some other, the prescription filled. And the pharmacist said, well, I have it right here. It's the tetanus shot vaccine. It's 400 pesos. I said, okay. So I started paying 400 pesos, and she said, well, no, you have to go over to the business office and pay them, and then bring the receipt back, and then I'll give you the vaccine. I said, okay. So I went to the business office, came back, and paid, and then she gave me the vaccine. And so I went back to the outpatient clinic, and I asked the guy there, I said, well, I need to get an injection. And he said, well, we don't do injections here. You have to go to the ER. Okay. So I went, I said, where's the ER? He told me where it was. So I went to the ER, and I went to the nurse there. I said, well, I have this vaccine. I need to get an injection. And she said, well, what you need is a syringe. I said, okay. Where do I get a syringe? And she said, well, you need to go to Central Supply and bring this paper with you, and go to Central Supply and get the syringe and come back. Okay, so I went to the Central Supply, and they said, oh, well, syringe is 30 pesos. Okay, 30 pesos. They said, no, you need to go to the business office and pay them, and then bring the receipt back, and we'll give you a syringe. Do you know where the business office is? I said, yeah, I do know where the business office is. Okay, so I went to the business office, paid them, got the receipt, went back to Central Supply, and then they gave me the syringe. Then I took the syringe and took it over back to the ER, gave it to the nurse, and the nurse said, okay, we'll give you an injection. So they gave me the injection for tetanus shot. And I said, oh, wait a minute. Now I have some other prescriptions that need to be filled, Augmentin and Neurontin. And the the ER nurse said, well, you need to go back over to the pharmacy. Okay, so I went back to the pharmacy and I said, well, I need these medications. And she said, well, sorry, but we're out of that. We're out of stock. I said, well, where do I go? I said, well, you see over there, across the street, there's a pharmacy over there. Oh, okay. So I went over there to the pharmacy across the street and I said, well, I need these medications. And they said, well, we don't have that. I said, well, what do I do? And he said, well, what you need to do is see down over there, further down the road. Yeah, there's a pharmacy over there. Oh, okay. So I went over to the pharmacy and I said, well, I need these medications. And she said, sure, we got it. So she got this box, and what they have is like, in the Philippines, they usually have what we would call in the United States unit dose. And they're like bubble packs, you know, of each medication, of each pill. So she shook the box and out came 1 unit dose pill. He said, well, I guess this is the only one we got. I said, well, how much is it? And she said, 50 pesos. I said, okay, I'll buy it. So I bought 1 pill. I said, well, where do I get the rest of it? Well, what you need to do is you need to go down the road about 2 or 3 kilometers, and there's a Mercury Drugs there. Okay, so I rode a motorcycle down there, went to the Mercury Drugs, and I said, well, I need to fill these prescriptions, and they said, yeah, well, we have it. Okay, so they got the medication. They said, that'll be 1,400 pesos, sir. So okay, so I paid for it and I got my medication. And that was it. And eventually, leg went down, swelling went away, and I was okay. So in the Philippines, it's the same thing, medication and medical treatment and so forth, but it's different. So you have to be able to be flexible when you're in the Philippines and you're getting treated. And that's it. Thanks for watching.